Hi, my name is Mackenzie. I am an emergency medicine doctor. I'm still a resident right now. I graduated from medical school 3 years ago from Georgetown University in Washington, D.C. I'm currently an emergency medicine resident in my 3rd year at San Antonio Military Medical Center. Porque estoy aquí para estudiar español médico. Porque muchos de mis pacientes en Estados Unidos solamente hablan español y quiero comunicar con mis pacientes más. Pienso es más importante para practicamos. My experience here this month in San Miguel with the MedSpanish program has been extraordinary, and it's been very positive. It's exceeded my expectations completely. What I expected was to really when you go to another country and you feel a little lonely, it's very hard and difficult to learn another language, and my experience here has been the opposite. I felt very included. I felt that people were very patient with me. They listened to me. Even though I can't speak Spanish that well, especially at the beginning. Now it's definitely a lot more, but still I'm not quite conversational. Everyone's been very kind, and I've been immersed completely, especially in the house that I'm staying with, in my classroom, in the hospital. It is purely in Spanish, and I've been able to completely expand my medical Spanish vocabulary tremendously. I love it. It is beautiful. Sometimes I think that I'm in medieval Italy. It is beautiful. It's actually I believe it's a national heritage site here. So everything's been preserved. Everyone's been, again, very, very kind. The cobblestones just make it so beautiful with the bells that ringing every hour, reminding you of the time. It's a very magical place. And the food here is excellent. It's a whole variety of it's founded in Mexican culture, but then if you really wanted to have Italian food, or if you wanted to go out and have some sushi, it's all excellent here, and I've never felt unsafe either walking around. Yes, absolutely. It's exceeded my expectations, in fact. Working in the hospital has been amazing. Being able to not only learn medical Spanish, but being able to see the difference in healthcare in the United States and seeing what healthcare is like in Mexico. There's been a lot of similarities, more than I was expecting, but there's also some major differences too, and that's really important to be aware of, especially when seeing your patients come into the ER, knowing their background, what they have known themselves, and then seeing them in the United States in the ERs. It's helpful just to know the background of these patients. Also, working with the Red Cross, I've been able to really see how the EMS system works here. It's very advanced. And Dr. Haywood Hall has done an amazing job in training their paramedics in this state and the rest of Mexico, I believe. And they definitely exceeded my expectations of what I was expecting. Yes. So nice, so funny. He's been very, patient with me. It's 3 hours a day, sometimes 4 hours a day. And we just have a great time. It's been only one-on-one tutoring, which is actually never what I've ever expected before. But it's been very, very helpful because he's been able to see what weaknesses I have and see what strengths I have, and he's been able to kind of go off that and improve where I need to be improving, and it's been very effective that way.